can go online to www.cdc.gov/travel, and then you'll type in your destination, and it'll tell you what are required and recommended vaccines and prophylactic medications that you should consider. Well, first off, we get a medical history. We also get a sense of your itinerary, where if you are going on a safari and camping and living off the land, so to speak, I'll be more likely to recommend a number of vaccines and prophylaxis, as opposed to if you're staying in a 4-star hotel in a western city, I'd probably recommend less vaccines. As a rule, no. Some of the vaccines may be reimbursed by your insurance, but most are not covered by insurance. A minimum of 2 weeks before you go. It takes vaccines an average of 10 days before you start building protective antibodies. Pretty much every vaccine, we're also a center for yellow fever, so we offer yellow fever, tetanus, diphtheria, measles, mumps, rubella, polio boosters, typhoid boosters, meningitis vaccines, any standard, routine, and travel-related vaccine we have available. You could actually receive a number of vaccines. 6 to 8 would not be uncommon. It would be uncommon in the sense that most people don't need 6 to 8 vaccines, but you could get them. The only contraindication would be you wouldn't want to take 2 live virus vaccines at the same time. They should be 1 month apart, but that's generally not a problem to get all the vaccines you would need at one visit. You do need an international certificate of vaccination for certain required vaccines such as yellow fever. There's a special spot in the vaccination booklet that I'd have to stamp and do all the bells and whistles. We actually give an international certificate of vaccination to any traveler that comes in, whether they're getting yellow fever or not. Well, you know, again, depending on where you're going, if you have access to medical care, probably nothing. If you're going to do a safari, you may want to bring a little travel first aid type kit, over-the-counter medications, Tylenol, aspirin, diarrhea medications. What we do in this in a travel visit is we usually give an antibiotic so that you would take it as needed for diarrhea or fever while on travel. Jet lag is a problem, the time differences. Some people may require a mild sleeping aid or anti-anxiety pill for the flight to and fro wherever they're going. So there's a lot of considerations that we make with the travel visit. Most vaccinations are not live virus or recombinant DNA technology. So other than local reaction of maybe soreness of the muscle for a couple of days, very, very few reactions. Some of the live virus vaccines might have within 12 to 24 hours a low-grade fever, but the side effects are minimal. We are a member of the International Society of Travel Medicine.